Broadcasting from the business capital of the world, this is the Podcast Business News Network.
We are so excited to have our friends back here again from Shores Wellness Solutions. And I know Amy McDaniel and Stopczynski and Dr. Dave, her husband, we're talking about skiing for the moment. And it makes me want to ask you all, but you're from Michigan. I don't even know the weather there. Is there ski slopes in Michigan?
Yeah, good question. I grew up in New Jersey, so I know Mountain Creek.
Oh, so you do know Mountain Creek. It was Action Park. Remember Action Park?
I do.
I was hoping the Alpine slide would still be there, but it's so different.
Yeah,
oh my goodness. So in Michigan, is there any place to ski?
Yeah, yes. there's small ski places, Boyne Mountain and things like that.
Think of it like the small Pocono Mountains.
Okay, perfect. And I could do that too. A Camelback I've been to, but yeah, I'm not a big skier, but we were on a little ski trip with the kids first time this weekend. So we just got to talk about that. Dr. Wendel is with us as well, and his beautiful wife, of course. Welcome. How was your weekend?
It was great.
What'd you do?
Wow, we set up the sauna. So the sauna is now up and running. We actually sat in it yesterday. So we are starting our extended health journey, which is super awesome. So that's all up and running. I need to decorate the room now to make it my Zen meditation spa room. So add all the crystals and all the fun stuff in there too.
Beautiful.
All right. We went to a boat show too, as well. This one.
Want a boat?
Well, no, we upgraded last year. We're not upgrading.
What do you have? I'm curious. I'm a licensed captain. I don't even own a boat, but I took the courses and I love boating. So
we have a Silverton XL, 34 foot.
Beautiful. Oh my gosh. Yeah. I just want a basic Sea Ray one day, like probably 34 feet myself, but one day. Good for you.
Got it, because it's a Jersey built boat.
Awesome. Is it? I didn't know that. Silvertons.
Yeah.
It's nice.
Built down in Milltown, down south.
Yeah, so we're going to fix it up, clean it. I mean, it's already nice, but you want to put your own tweaks in, clean up the paint strips on the side, make it really pretty. At least that's my part. I'll let him be in charge of driving it, and I'll fancy it up and make it look really nice.
And I love that. I love it. Well, thank you guys for being here at Shores Wellness Solution. You all do so much. I know today we're focusing on migraines and headaches, but just overall with whole health and whole food nutrition. I mean, the two of you really, let me just remind everyone how we can find you. shoreswellnesssolutions.com might be a great place to start. And for today, what do we have in mind?
Well, we decided to talk about headaches because headaches are the #1 rated health complaint in America, even surpassing the common cold.
Isn't that crazy?
I never knew that either. Wow.
75% of all people will report having a significant headache by the age of 15. So headaches are really, really important to talk about because even at young ages now, kids are getting headaches and dealing with these things for long periods of time. And we want to make sure that we can help you resolve those things, let you know that there are things that can be done to help prevent headaches. You have to understand that if you are a migraine sufferer, someone who's been having lots of migraine headaches continuously for a long period of time, you are going to need to make some serious lifestyle changes if you want to get freedom from these headaches and migraines. So we're going to go into a little bit more depth about, who are getting headaches, why you're getting headaches, how you can prevent headaches, and what you can do if you do have a headache to help resolve them as well, because they're very, very prominent here. Everything.
Right. And a big question is who gets headaches? It's almost everyone. About 90-95% people of the population experience headaches at one time or another. And it's estimated that about 50 million people in the United States suffer headaches on a regular basis.
Okay.
2.5 million people have one or more migraine a week. That's crazy.
And what is considered a migraine, by the way? I mean, is it the amount of pain, the throbbing of the pain, the consistency of the pain? What's the difference between a headache and a migraine?
I'm going to go with a yes on that question.
Okay.
So there's a lot of different types. We're going to talk about all the different types of migraine. Okay. So headaches and things like that and a migraine. Migraine usually can come with aura or without. So basically seeing different spots and things like that. If you have a really bad migraine where you're seeing those spots and things like that, you're going to feel dizziness, nauseousness, not really be able to function at all. Where usually a headache isn't quite as bad, You're not going to necessarily feel where you can't function and you're not laying in bed for, several days because you can't get rid of what's going on with a migraine.
Right. And the migraine headaches in general affect more than just the person with the headache. So for instance, Jill, if you have a really bad headache and you go home to the family, you're not going to want to do the things you normally do, which might include, maybe some wash to catch up on that cooked dinner, look at homework with the kids, because you're just not able to concentrate and do those things because of the debilitating pain that you're experiencing.
Migraines a lot of the times you'll have blind spots. When you're trying to focus on things, you're not going to be able to actually see. You'll see different like black and blue spots in your vision. You'll have zigzag lines that are going through your vision, so you're not able to see very clear. Sometimes you may experience like flashes of light, but because of all those things, it starts to make you feel sick. You're not able to actually see what you're trying to see. And so you'll get nausea, vomiting, you'll get very irritable. A lot of times your blood pressure will drop as well. You'll be very sensitive to light and sound. And it really is debilitating when you have a migraine versus a headache.
Sure. And the headache could cause you to miss school or work. It can reduce the productivity that you have. As I mentioned, you might not be able to do the household work that you need to be done. It's going to reduce productivity. Because of the headaches, you'll be forced to miss family or in social and activities because of it. And the real question I want to ask is, well, what is the quality of your life that you're experiencing or having while experiencing these headaches?
Not good, I'm assuming. Can't be easy. I don't get them often, but when I do, oh my goodness. And I feel bad for those out there who really suffer with this.
Yeah, and migraine headaches can be on one side. They can wrap around from the eye backwards. They can cover the whole half sphere or half of a head. When you have migraine headaches, tension headache is more like a common band around the head. Just think of those ski bands that we used to wear back in the 70s, early 80s. If you feel a headache in that distribution, it's probably a tension headache. And the tension headache is coming on because of the things that go on during the day, the tensions of work, the tensions of family, maybe finances aren't in shape, maybe it's just the foods that you're eating that are leading to that as well.
Right. You can also get headaches due to sinuses and allergies. That can contribute because you're getting really a lot of pressure and sinus issues going on, cluster headaches. You can have post-traumatic headaches is another big one. With the post-traumatic types, that's somebody who's gotten into an accident or things like that. But a lot of times with that, those people don't seek treatment. And so they don't end up getting like a migraine or something until a week or so later. So anytime you've had any kind of injury, falling, hitting your head and things like that, it's really important to get checked out by your doctor or a chiropractor as well, because if you hit your head in a certain way where you're out of alignment, it's going to put pressure and you're going to end up getting headaches that way as well. And so it's really important to get those things checked out, because otherwise it can turn into a more serious issue down the road.
And when you're talking post-traumatic headaches, traumas that people don't recognize, the little baby smacking its head into yours, or maybe a dog whacking you, or just something real simple. Maybe it's in sports, heading the ball in soccer, a tackle in football, a missed catch in cheerleading. It could be martial arts, taking a fist or a foot to the face. And so these are things that you don't even think about as far as traumas go. Usually we think of the big traumas.
Yeah, like a big car accident or something like that. Right. People, and even then, it's amazing how many people we talk to when we're doing consultations and, you ask, have you had any, car accidents and things that, oh, nothing major, just a little fender bender and things like that. But those are the little things that actually add up to big things. And so it's important to know that those little injuries can be serious down the road because you cause yourself to be out of alignment. Well, after a while, that pressure is going to keep putting pressure on your nerve and you're going to start getting more and more pain, which will cause headaches long term. So people don't understand sometimes that those small little injuries that we don't really think, because we feel fine, and you don't always relate, hey, I have a headache a week later or 5 days later. You don't relate it to the fact that you fell down and hit your head playing soccer, or your child did. you just think, oh, okay, so we want to try to teach people that you want to pay attention to those things also, and they are important.
And you look at, the minor car accidents, under 10 miles an hour, it only takes an 8-mile-an-hour accident to put a 5G force through your head. And if you have your head moving that fast, that's a lot of trauma just from a very small accident.
Wow. Mm-hmm.
And the insurance industry knows this, but they don't promote it because people look at their cars and they go, oh, not much damage, I should be okay.
Yeah.
And then these things will pop up a week, a month, or 6 months later.
So some other types of headaches, migraines, are the facial subtype. Okay. So those could be caused by dental issues, TMJ, bruxism, which is grinding of the teeth. So a lot of people grind their teeth.
Oh, gosh.
Their stress causes a lot of tension and headaches, sinus problems, allergies. Those are all different things that can also contribute to your headaches. So it's really important to kind of figure out and get to the root cause of some of the reasons that you may be also getting these headaches, because there's a lot of different kinds and a lot of things that you can do to help correct them.
Oh, my turn.
And you're supposed to tell us, I think. She loved you too. It's so cute.
Well, this would be a good time to take a break and let people know that are out there suffering with headaches how to contact us. You can reach us at 586-445-8032. Or if you want to email us, we can be reached at changinglives@shoreswellnesssolutions.com.
Or our website, shoreswellnesssolutions.com as well.
Beautiful. All right.
Awesome. We look at costs on headaches. On average, with migraines, people lose about 6 days of work per year. The pain and disability usually increases over time, and it's over $1 billion of medical costs per year. And employers lose about $13 billion in missed work and productivity from people suffering with headaches.
I'm going to go into the women's aspect for just a moment, just because that's what I tend to more specialize in. And so everyone's always talking about thyroid and their thyroid hormone. Okay. So it's really important to know that a lot of thyroid issues are linked to migraines too. So it's important to check to see if your thyroid is off. Okay. So you can do that by blood tests a lot of times, but I want you to know, I know, see why you're saying that? He's like, blood tests are good to kind of help with, determining what's going on. But you need to know that you have to lose more than 40% of your thyroid function for it to show up on a blood test. So we like to do other testing as well. I think it's important to use multiple testing to see what's going on, because let's say you're having all of the symptoms, you're getting these migraines all the time. You go in for blood work and it comes back, hey, it's normal because it's 39% dysfunction, but you still have all those symptoms. So we use something called nutrition response testing. Yes. We're going to check that as well. So we'll check your thyroid with that. We'll check against chemical stressors and food sensitivities and all those things as well, which is another way we can check. We also use thermography in the office, which is really important, not only to check the breast that we talked about previously, but to also be able to check your thyroid, because we can check to see, is there inflammation? Is there something going on that we need to address? Because let's say it doesn't show up on your blood test, but you still have issues. You want to correct it. So we're going to check a couple other ways so we can make sure that we can see what's going on and if that's what's causing your headaches.
And a lot of times with thyroid insufficiency, as Amy said, that leads to headaches. But if you have a liver dysfunction, you have to lose at least 80% before it might, keyword there is might, show up on a blood test. So if your liver is functioning at 50%, that has direct effect on thyroid function. We get a lot of patients that come in that are told they have thyroid dysfunction. And when we evaluate them, no, their thyroid's fine. It's a liver dysfunction that's showing up and mimicking that thyroid issue. When we correct the liver dysfunction, thyroid comes back working perfect.
Oh, crazy, right?
Go ahead. All right, a little kick for chiropractic. Dysfunction in neck muscles contribute to headache pain, and that's a reason why chiropractors deal a lot with people with headaches and tension headaches. And in a little side note, people that take an aspirin or other medications 2 or 3 times a week for headaches, those headaches will eventually become chronic and daily, not just intermittent. So the more you medicate, the worse it'll get over time.
Yeah. So we're also want to make sure again, getting adjusted plays a big role in getting rid of your headaches. You want to get your atlas adjusted so you can make sure that the nervous system is working properly. Because if you have pressure, if you have something sitting here putting pressure constantly, unless you relieve that, it's going to put tension in your neck and all of those things. And let's be real, most of us are pretty stressed out on a regular basis anyway. We're working on computers all day. We're on our cell phones all day, especially the younger kids. So we're always sitting hunched over like this. You're putting all this strain and tension on your upper back and your neck and things, and we're not doing things to counterbalance that, so getting checked, getting adjusted is very important.
Right, because you want to relieve the pressure on those nerve roots in the upper neck, and that would really reduce the pressure down the spinal cord and to what's called the facial nerve, or the number 5 facial nerve, the trigeminal, which is the root or the pattern that people get headaches. And chiropractic adjustments have been proven more effective than medication in treating headaches year after year after year over the last 50 years.
And when you also, things to consider, when you're having a structural migraine, something that's in your neck, the tension, all of that, most of the time too, it's due to really heavy stress and things like that. And we want to make sure there's ways to relieve that stress. Taking time for yourself and self-care is really important. Getting away from your cell phone and the TV so you can, step out, take a walk is really good. Doing something, moving your body a little bit is a great thing to do. You can also do massage. We offer massage now in our office, and aroma touch, things that are going to do to release that stress, taking some time for some self-care. If you do have a lot of tension in your neck, I always like to give a nice little tip to our patients, because we are sitting forward so frequently doing this on a computer and all these things that we're not stretching. So a simple thing you can do even at home is when you go home, take and lay your head off of the back of your bed. So your neck goes, hangs off the back a little bit. And you want to just lay there and let yourself relax so you can stretch backwards. Even sitting in your desk, take a moment to sit up straight and pull your head back. But by doing that off the side of the bed every day, you start out with just a minute and increase that time. So you're putting that curve back into your neck, and you're not putting all of that pressure on the upper back where you have that extra load. You're taking that pressure off. And it's a simple little thing you can add to your daily routine that doesn't take a lot of time. It doesn't cost you anything, and it'll help take that pressure off of the neck, especially if you're on a computer on a daily basis or on your phone and things like that, where you're putting all that extra pressure on your neck.
And a lot of headaches are what we call viscerogenic. They're generated from the gut, from the viscera or the organs in your body, particularly the liver. And so one of the things, as we mentioned earlier, is you need to be looking to make lifestyle changes if you want to get rid of your headaches. Our diets are highly saturated with carbohydrates and sugars. Really need to reduce those. You need to reduce the man-made foods, the convenience foods that are loaded with chemicals, because all that puts a heavy burden on the digestive tract, particularly the liver and gallbladder and the pancreas, and that can be contributory to headaches. And so it's so important to make sure that you're willing to change that. We need to have a diet that is high in fats, but not high in animal fats or man-made fats, high in good fats, olive oil, avocados, coconut oil, nuts, seeds, butter, those types of things.
Let me ask one quick question, if you don't mind. As far as, headache, I want to also ask you this. It's anything to do with it. Doctors sometimes say take a mini aspirin every day. Is that for like your heart and blood flow? That has nothing to do with headaches or relieving any tension in the head. Is it like that 88 milligram, whatever it is? It's a baby aspirin. Does that have anything to do with headaches?
81 milligrams. So,
yes, that's it.
aspirin a day. The original study was done in Europe, and they were looking at thinning the blood and heart disease. And they said, oh, look at this, an aspirin a day decreases your risk of heart disease. And so in the United States, we run with that for the last 40 years, doing roughly 5 tons of aspirin sold every day. In Europe, they redid the study because they looked at the aspirin supply they had, and it was laced with or mixed with magnesium. So they redid the study with magnesium and aspirin, and they found out that people taking pure aspirin became more sickly and infirmed, and the people who were taking the magnesium had the positive results. And so the United States just swept that under the corner or under the carpet so we can sell 5 tons of aspirin a day. But remember, aspirin causes microhemorrhaging. So if you look at when the study came out and when we started teaching people to have an aspirin a day, not us, but the medical profession in the United States, you follow that chart, you'll also see the incidence of stroke and vascular injuries rising as the use of aspirin became more commonplace. So what's the point? The point is an aspirin a day leads to higher risk and incidence of stroke and vascular issues, not good health.
All right. Thank you so much for letting me chime in. Go ahead. Continue.
Well, talking about magnesium, estrogen is believed to be the main reason why women have more migraines than men, which is why women tend to have them right before or during their periods, because their estrogen levels drop during that time. So if you think about it, as women, you'll know, you're getting close to your period and you just aren't feeling right. You tend to get more headaches, things like that, because your estrogen levels are dropping. So it's really important to add that magnesium back into your diet. It's really important for helping calm the nerves because they get overexcited. And so you really want to, foods you can do would be spinach, Swiss chard. Those are going to give you about 40% of your daily needs. You can also use sweet potato, banana, sunflower seeds, sesame seeds. And sometimes your levels are so low because you depleted it so much, you do need to use supplementation. Okay, so it's important to use the right type of supplementation. Again, we talk about this all the time. You want to use a whole food supplement, not a synthetic. A synthetic is something that's created in a lab that you get at most stores. And when you use a synthetic product, you put more strain on your liver, which causes more issues. So you want to use a whole food supplement. We use standard process here in our office in MediHerb for the herbal aspect of things, but standard process to get that whole complex so your body can actually do what it needs to do. And so you can help eliminate those headaches as well.
Good.
All right.
Thank you. Go ahead.
Hi, you're welcome. So real quick, if you want to reach us, we are at 586-445-8032. And our email is changinglives@shoreswellnesssolutions.com. Not giving you Amy's phone number this week. And our website is Changing Lives. No, it's not. Our website is shoreswellnesssolutions.com.
And just curious, is there any foods or anything that we should be more aware of that maybe help with headaches? I mean, anything that could help us not get headaches? Is there certain anything in food that matters with headaches at all?
Well, like I said, magnesium is really important to prevent it.
When and what foods in particular is magnesium?
So that's you're going to want spinach, kale, sweet potatoes, or some of the foods.
Swiss chard,
nuts and seeds. Those are important to incorporate every day. We always do we used to do them all the time, but smoothie classes and things are an easy way.
Yeah.
And getting a smoothie in where you're blending up the spinach, the kale, put your greens in with your other berries or a banana and things like that, because it's going to increase that magnesium in an easy way that you can get in every day. Adding that simple thing in every day is really going to help you get the things in that you wouldn't eat. If you took everything you put into your smoothie and you put it on a plate and tried eating it, you would be full fast because you have this huge plate filled with lots of greens and vegetables and things like that. You can throw it all into your blender, into a smoothie, drink it in the morning, and you're going to get those nutrients in your body really fast with added fiber and things like that too. So you're going to be full, and it's really going to be an easy way to add that extra magnesium and stuff in to help prevent the headaches.
Got it. Right. Thank you so much. And we still got 2 minutes left on the clock. Anything else that you want to add before we go?
Stay away from the environmental toxicities, chemicals being sprayed, particularly on food, not just in the air. Watch out, you can reduce certainly what you're putting into your body that could be causatory, like the man-made foods, all the chemicals and the processed things. Just stop it.
Yeah, all of those things. A lot of times people have a lot of heavy metals in their body. Again, that's where nutrition response testing comes in place, because we can check you to see if you've got fungus, mold, heavy metals, and things like that in your body. So we can give you the correct whole food supplement to pull those out of the body. A lot of times we have it in our homes. I mean, think about it. You spend a lot of time in your home, either home or the office, right? Most people are either at work or at home. And a lot of times there can be mold throughout where you're working, where you're staying, heavy metals and things, because people use a lot of toxic cleaners and chemicals. And as you're breathing that in and exposed to that on a regular basis, it's really going to build up in your body. So that's where we come into place, because we want to check that. If you're getting headaches regularly, we want you to come in. We want to check you to see if those things are causing it. And if they are, we can give you the right things to pull them out of the body.
And physically, you can get better sleep, prepare yourself to sleep, make more time for sleep, get rid of the things that interfere with that, like TV, and also exercise. You don't need to kick off the roof and punch out the windows, but get some regular, gentle exercise also to help reduce the stress levels and relax the body.
Perfect. Thank you again. And would you mind reminding us how we can reach you one more time?
All right. We are shoreswellnesssolutions.com, 586-445-8032. And you can email us at changinglives@shoreswellnesssolutions.com. Again, I'm Amy, and this is Dr. Dave from Shores Wellness Solutions, and we want to be your inspiration
for healthy living.
All
Perfect.
right.
You sure are. Thank you today. Great conversation. Great topic. Thanks so much for enlightening us again, and have a fantastic day. To all of our listeners, stay tuned. More of the show is on the way.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.